welcome to our concept analysis video. My name is Amy Cannon.
And I'm Amber Kelly, and we are about to present a concept analysis on motivational interview.
Nursing has always been considered a borrowed science. This is exemplified through nursing's use of the concept of motivational interviewing. Developed in the 1980s by psychologists William Miller and Stephen Rolnick, they utilized this communication technique as a successful approach to therapy for their clients with substance abuse problems. They realized the importance of the patient identifying a discrepancy between a behavior and their own personal health goal. The concept of motivational interviewing was based on well-known psychologist Carl Rogers' theory of client-centered personal development.
Although many authors have defined motivational interviewing in their own work, through our literature review, we have noticed that they all stem from Miller and Rolnick's original definition, which states that motivational interviewing is a client-centered, directed method for enhancing intrinsic motivation to change by exploring and resolving ambivalence.
Our purpose in doing this concept analysis is simple. We wanted to investigate both the usefulness and effectiveness of motivational interviewing as originally a psychology-based theory as it relates today to the advanced practice nurse.
In discussing specific definitions for motivational interviewing, we would like to point out that through our literature review, we've noticed that McCarley defines motivational interviewing as a way of engaging patients to manage their own care. Goodwin and Associates defines motivational interviewing as a launching pad for adopting healthy behaviors. And Thompson and Associates used their original definition of Rolnick and Miller, but expanded on the definition by describing the concept's focus as being eliciting the person's intrinsic motivation for change.
Motivational interviewing consists of certain attributes. It is a communication style and technique that is patient-centered. It is respectfully nurse-guided, but patient-initiated. It is not a step-by-step process, but a technical style in which the nurse practitioner evokes a need for change based on the discrepancies between an action and a goal. Research shows that motivational interviewing is most effective when interjected into casual nurse-patient encounters. Unlike in some other cases, Walker and Advent and Chin and Kramer all essentially agree that a model case is an exact example of the concept that includes all of the defining attributes. The major difference is that Chin and Kramer call this an exemplary case, not a model case. A model case for the concept of motivational interviewing would be as follows. RS is a 35-year-old Caucasian female with a pack-a-day nicotine addiction. She is a frequent visitor to the medical clinic as she has 3 small children that also receive their medical care from the advanced practice registered nurse. RS receives a diagnosis of acute bronchitis. After receiving this diagnosis, she makes the following comment. I get this bronchitis every year and it is getting harder to kick it each time. I don't have time to deal with this again. I just wish I could be healthy for my babies. The APRN recognizes the patient's desire to be healthy. She knows that this nicotine addiction and smoking habit is increasing her risk not only for acute bronchitis but also for chronic bronchitis. She knows that the APRN asked the following open-ended question to elicit change talk. Is there anything in your life that you feel may be contributing to this annual bronchitis? Upon considering the question, RS realizes the discrepancy between the action of smoking and her overall goal of health. RS answers the question with, I am sure my smoking does not help, but I am just not ready to give it up yet. The APRN shows empathy for the situation being considered and respectfully guides the patient through the consideration process. RS agrees that she needs to quit smoking and sets a goal to decrease to half a pack a day prior to her follow-up visit in 10 days. With a related case, the authors agree that the differences lie within the defining attributes. At least one of the defining attributes must be different, although it may be similar. A related case for the concept of motivational interviewing would be as follows. The APRN gives RS a diagnosis of acute bronchitis and asks the following question. Don't you think that by quitting smoking you would get bronchitis less often? RS responds by saying, I do wish I could be healthy for my babies, but I am not ready to quit smoking. The APRN knows that this nicotine addiction and smoking habit is increasing her risk not only for acute bronchitis, but for chronic bronchitis and eventually COPD. The APRN continues the conversation with the patient by asking the following open-ended questions to elicit change talk. Is there anything in your life that you feel may be contributing to this annual bronchitis? RS answers with, I am sure my smoking does not help, but I am just not ready to give it up. RS agrees that she needs to quit smoking and sets a goal to decrease to half a pack a day following after her visit in 10 days with the nurse practitioner. In this situation with the related case, the difference was the way the conversation was initiated by the nurse. It was not patient-initiated.
The authors vary on their definition of borderline cases. Chin and Kramer define the borderline case as one in which the concept in question is used out of context. An example of a borderline case would be as follows. A student nurse tells the APRN that she has asked RS all the questions on the smoking cessation questionnaire, and the patient knew all the right answers. The nurse then tells the APRN, see, I was motivated and interviewed her. She must really want to quit. Although the student was motivated in her actions to interview the RS, the patient, she misunderstood the concept of motivational interviewing. In contrary cases, the author agrees on the definition. They define it as an obvious misrepresentation of the concept, although some components may be similar. An example of a contrary case would be as follows. After the acute bronchitis diagnosis, the APRN recognizes the correlation between smoking and bronchitis and responds to the patient by saying, yes, you must quit smoking. If you do not, you will certainly cut your life short and have a miserable existence in the end of your life. Then where will your children be? As you can see, none of the defining attributes for motivational interviewing was present in this case.
The invented case is a little bit different. According to Walker and Avent, an invented case helps to illustrate a concept in a way that is definitely out of its normal context. It offers the reader a clearer understanding of the meaning. These cases include ideas that are outside of one's personal experiences, but are very useful when examining familiar concepts. An example of an invented case for motivational interviewing would be as follows. A peasant woman is informed by the Queen's lady-in-waiting that she has been invited to dine with the Queen at the Royal Women's Luncheon, which is held at the palace each fall. Upon considering the invitation, the peasant graciously accepts the offer. The lady-in-waiting asks the woman if she has any concerns pertaining to the dinner. The peasant replies, I am so excited to have been chosen to dine with the Queen. However, I do not know which utensils to use, as I am poor and have no utensils. The lady-in-waiting realizes that the peasant's overall goal is to fit in at the luncheon with the Queen, and that the behavior in need of change is her current state of table manners. She educates the peasant woman on proper table etiquette, and the woman has a wonderful time at the luncheon. In this invented case, it is clear that the goal of proper table etiquette was reached through behavior change after being guided with open-ended questions and education by the Queen's lady-in-waiting.
There is only one true antecedent with motivational interviewing, and that is behavior.
And the ultimate consequence of motivational interviewing is behavior change. However, there are many others that could become evident depending on what the behavior change is. Some of those might include empowerment, confidence, improved health, intrinsic rewards, ability to self-manage, risk reduction. I'm sure there are others. The possibilities are endless.
Empirical indicators would include any of the objective data pertinent to the individual situation. These would include, but are definitely not limited to, weight, lab values, appointments, length of stays. Qualitative indicators would include all the subjective data pertinent to the individual situation. These would include a patient's attitude, questionnaires that they fill out, family or caregiver report.
In defining the operational definition of motivational interviewing, we feel that although this is a patient-centered activity, the nurse must utilize several basic therapeutic communication techniques. These would include things such as asking open-ended questions, affirming and summarizing, and using reflective listening. We feel that the nurse is pivotal in this process.
In summary, we would like to conclude by saying that motivational interviewing has been proven to be an effective communication style that encourages a change in an actual behavior and the wanted goal.
And successful use of this technique will help the patient to identify the behavior that needs to be changed so that they can fulfill their ultimate goal.
Motivational interviewing is patient-initiated but nurse-guided.
And it should always be the goal of the nurse in motivational interviewing to guide the patient, not lead the patient through this activity. Thank you so much for joining us. Our references will follow. Thank you.
Thank you.